In the European Commission co-founded project CareWell, 6 disparate sites came together to find individual solutions for one common problem: bridging the cracks between different healthcare providers in the provision of care to their chronically ill patients. 2 of the main building blocks of the CareWell project were patient empowerment and integrated care coordination. Module 1 of this video guides you through a typical patient scenario, in which the patient receives benefits from CareWell services. Module 2 defines important terms and concepts of the CareWell project while highlighting why the suggested services are valuable and beneficial. Module 3 explains how similar services could be deployed within your own local and regional healthcare setting. If you are a professional in the healthcare sector, we hope this video will provide inspiration for local or regional solutions to improve patient empowerment and integrated care coordination, while also explaining relevant terms and concepts. Module 1: A patient scenario. Let us take a closer look at Mary. Mary is a patient with multiple chronic conditions, 2 of which are chronic obstructive pulmonary disease and diabetes. Mary felt that she was not empowered to champion her care independently. Furthermore, the condition of her care was not what we call integrated. Over the last few months, Mary has suffered from recurring skin infections that would not completely heal, increased thirst, and shortness of breath when only walking up the stairs to her bedroom. The unaligned treatment schemes she received from her various health professionals did not help alleviate her medical conditions. Her diabetologist asked her to write a food diary and ordered the same blood examination as her GP, not knowing that the blood samples had only recently been taken. The GP, however, was not aware of the food diary and could not reassure Mary of the importance of substituting certain food items such as sugary drinks or the pork she loves so much with healthier items such as water and more vegetables. This experience left Mary feeling like she was just part of a machine that does not respond to her personal needs. Mary had to tell each professional individually about her various conditions and did not feel involved in the decisions that were taken about the care that she receives. She merely followed each professional's advice without being enabled to fully understand the implications these decisions would have for certain care pathways and whether any of the advice was contradictory or duplicate. Mary was also annoyed by having to make several trips a week in order to have blood samples taken at various different practices. On top of this, Mary was left feeling neglected by the lack of a joined-up approach from her GP, pulmonologist, and diabetologist. If they had worked more as a team and communicated on an integrated care approach, Mary would have felt much better cared for. A few months later, Mary visits her GP's practice for a periodic checkup and tells him how well she feels and how much more satisfied she is with her current treatment. This rapid turnaround was mainly achieved through the use of integrated approach from the CareWell project. Following the subscription to CareWell by her GP, diabetologist, and pulmonologist, a care manager from the GP practice contacted Mary to inform her that she was eligible to join a new approach to deliver her integrated care and to improve patient empowerment. This approach was new and for now only provided regionally to meet regional needs. Mary was excited and subscribed as a participant in CareWell. Mary had a care manager who was available to counsel Mary on concerns about her diabetes and COPD via text messages. The care manager periodically assessed topics such as nutrition, smoking, depression, physical activity, and other things. He also checked, together with Mary, whether the agreed therapy had been adhered to and if Mary was aware of how to deal with her conditions. Mary was also provided with home monitoring devices such as blood pressure meter, glucose meter, and oxygen flow meter. The measurement results of all those devices feed into Mary's electronic health record on one simple click. If her clinical parameters were out of range, the care manager would receive an automatic alert to activate specific procedures. Mary felt much more supported in her self-care and self-management through those devices. This is without even mentioning the various practice visits she saved through the use of home devices. Working in the background were Mary's diabetologist and her pulmonologist, and not forgetting her GP. All were involved in the care plan as they joined a virtual community of health professionals. Using an online platform which hosts a care team dedicated server environment, including a warning system which creates individualized alerts if a message, a medical report, clinical documents, or prescriptions were issued. The professionals were also able to use an online video conference tool to directly consult with each other. The online platform allows the specialists to access Mary's electronic health record and share information with the care manager and other specialists. Mary is very happy to live in one of the CareWell project regions, where her GP and several medical specialists are involved in delivering CareWell services locally. Yet, she wonders how such projects come about and who manages them. Furthermore, could her friend from a different region also benefit from such a project? And who pays for something like that? Module 2. Terms and concept. First of all, we must clarify what we understand by the term integrated care. By integrating care services, we want to reduce fragmentation in patient services, meaning bridging the cracks in the coordination between different healthcare providers and enabling better coordinated and more continuous care for an aging population with an increasing incidence of chronic diseases. Multiple stakeholders are involved in the integration of care. In CareWell, those included are patients and their informal carers, with general practitioners and practice nurses, with medical specialists, hospital nurses, medical coordinators, social workers, and call centers. Of course, for the integration of care services, this list is not exhaustive, and relevant key stakeholders depend on the local and regional setup of the healthcare sector. The CareWell project aimed to improve the integration of care with the stakeholders mentioned along two general pathways, namely care coordination and patient empowerment. Care coordination, on the one hand, refers to the facilitation of information sharing between health and social care professionals to avoid unnecessary referrals, delays, gaps, or overlapping of care provision and to increase the professional's decision-making capacity. Means to improve care coordination include the introduction of professionals such as care managers who conduct a first health assessment to determine care needs, electronic health records to document and share all relevant health information, call centers and virtual meetings for patients and health professionals, improved ICT systems for communication between multidisciplinary teams, messaging systems, or care managers for case coordination. Patient empowerment, on the other hand, aims to enhance the patient's self-management capabilities and awareness of their health status based on educational, home care, and telehealth services to maintain the patients in their homes. Patient empowerment decreases clinical deterioration and additionally improves the patient's experience with the care they receive. CareWell partners used home-based telemonitoring and telecare to screen patients remotely and intervene if any clinical deterioration or social needs appeared. Other means used by CareWell partners locally include patients' access to their own data via digital patient dashboards, as well as web-based patient education and improved self-management. Such online platforms allow patients to view their medical reports, consult their drug or vaccination history, and check on upcoming appointments. Patients are also able to contact their health specialists directly using those platforms. At the interface of care coordination and patient empowerment are medical devices that enable patients to conduct self-measurement and subsequently allow health professionals to remotely monitor this data and take appropriate action if necessary. Examples of devices used at the CareWell sites include HDMI sticks with training videos, technical devices such as webcams, microphones, or smartphones, medical devices such as weight scales, blood pressure meters, pulse oximeters, spirometers for peak flow measures, or glucometers for blood sugar measurement. While not all of these devices were used at every pilot site, most applied such devices at the patient's homes. Evaluations of CareWell services verify the positive effects of improved care coordination and patient empowerment that were anticipated. The evaluations used multiple measures such as the Barthel score, self-maintaining and instrumental activities of daily living, IADL, patient satisfaction measures, Geriatric Depression Scale and the eCare Client Impact Survey, or the PIRO questionnaire on user experience of integrated care to investigate the evidence of improved patient empowerment. The clinical relevance of the project was determined by measuring the number of hospital admissions, hospital days, readmissions, contact between healthcare professionals, multidisciplinary teams and patients in comparison with control groups. Module 3. Call for Action. We have seen that the integrated care can improve patient empowerment and care coordination locally and also on a regional level. As a matter of fact, there are already several projects out there running in different European countries, improving the level of integration of care professionals who deliver care to their patients and working towards improving patient empowerment. If you are a patient, we invite you to ask your care professionals whether they already participate in an integrated care project or if they may even be running one themselves. If, however, you are a policymaker or if you are in a position to make decisions on matters such as integrated care, we would love to see you initiating your own project, connecting care stakeholders and empowering patients to live more independently. We hope you can find a solution for your care services situation and benefit from the diverse impacts such a project can have. For further inspiration, you will find our guidelines for deployment on our website. You can also get in touch with us for further consultation with our experts in the field. Please spread the word and share this video with your local, regional, and international partners, as well as the general public.